Joining me now is Dr. Ryan Jennings, the Chief Medical Officer of HSHS St. Anthony Hospital. Good morning, Ryan.
Hey, good morning, Gail. How are you?
I'm doing great. How about yourself?
Not bad. Wrapping up Nurses Week.
Yeah, that's right. I actually talked about that because, let's see, it was National Nurses Day one day, the next day it was National School Nurses Day, and the next day it was National Student Nurse Day. So,
it's kind of amazing now. There's so many roles for nursing.
Oh, I know.
It's an incredible field, and yeah, today it finishes that. Of course, this week is actually Hospital Week, so this year there's a little bit of overlap between the two.
Yeah, I have so much respect and admiration for nurses because, well, they're just amazing people. I mean, that's not really a career; it's a calling, in my opinion, and they do so much.
I wouldn't be where I am today without the support of a whole bunch of them, that's for sure, including my wife. So
they are great people, I'm telling you, absolutely fantastic people.
Well, and this week's exciting, too, because we did start back to doing some elective surgeries this week, with the clearance from the governor to begin that reopening of elective processes for patients. So yesterday was our first day of getting to do some elective cases again, and went very well. Of course, trying to work our way through the testing requirements we talked about last time of having to have the patients that are coming for surgery tested 72 hours or less prior to their upcoming surgery. So some logistics to that, but on the whole, that's gone very well. And fortunately, with all that testing that was done, no one was identified as positives, and the prevalence in the county and things like that continues to be very low. So we're very fortunate still at this point.
Such good news, and I bet it felt wonderful to get back to at least a little normalcy.
Yeah, no kidding. And I know the staff was excited to get back to doing what they do best, and so yeah, we're finally on that road, and you're going to see some more testing in the community. Actually, the Southern Illinois Healthcare Foundation, which is one of the federally qualified healthcare clinics in the community here, actually got some additional support from the Illinois Department of Public Health to do some surveillance type testing within the community. So they've got several thousand test kits, and here in the next few days, we thought we were going to be ready, or they were going to be ready Monday, but it looks like it may be a little later this week, behind Building A there on Temple Drive, so the health center there. They'll be setting up a drive-through testing facility. There is a process for that, and I'm sure they'll be putting out more information. There's a phone number that you call to go through a screening process, but they're focused on basically testing anybody that meets the current guidelines, which includes all essential workers. And so basically anybody that's been able to return to work now, whether they have symptoms or not, would be eligible for testing through that testing facility once it gets up and rolling. So we'll help to share information about that as we get more details, but that'll help us to get a better idea again of how much is out there in the community, and what are we seeing the impacts of as they reopen some of the businesses and things. And with the masking requirements, yes, but still, anytime you get more people together, we may see some surge.
Absolutely, yeah. I mean, that's just common sense. You just know that's going to happen. But this extra testing is just fantastic news.
Yes, it is, and we're very fortunate that through the federally qualified piece of this, they've been able to acquire those testing supplies, and again, that'll help us with the whole Restore Illinois process that the governor, of course, announced earlier, I guess last week now, and what that looks like as we try to move across the various phases over the coming months, trying to find that balance between the safety of the population, but at the same time getting us back to work. And so, as you know, part of the requirement is that there's a stable prevalence of the amount of positive tests within the community for a 28-day time span. So this testing will help us to get an idea of where that's at, and hopefully by the end of this month we can be moving into phase 3 and just kind of keep it keep it moving. The biggest thing there that to me that's the most interesting, of course, is the utilization of hospital beds and intensive care beds and ventilators and those types of things. That's monitored on a daily basis. We all submit data now to the state, and so as they look across the regions, they can help us to guide where resources are available. Like we've talked about, we're very lucky to live in this region where we have the access to all the Region 6 resources, but also resources through our own health system. And so the state's helping to guide that, again, with the idea that if we start to see changes in the patterns of the disease or increase in utilization of hospital beds, that we can take a step back if we have to be sure that we don't overrun the healthcare resources. But right now, everyone is well positioned to continue to move forward, and thanks to a lot of tremendous work and sacrifice by our communities to keep us all safe, we're finally starting to breathe outside.
That's fantastic. Such good news. I mean, all of that, the possible reopening in the near future, everything that you just said is fantastic news. Now, I have a question as far as, this is the question that I've been getting from listeners, a couple of them. First of all, where is research at right now as far as a medication that works for this or a vaccine?
So the medicine, actually, there is one of the antiviral medicines that's got a really funky name,
Yeah, sure. We all know about those.
That's the professional name for it. That's the same way I write it when I use a pen. It's just an R and some squiggles, and thankfully the pharmacy figures that out. But actually, Illinois did receive a significant shipment of that supply of medication to be used during this with appropriate waivers, and several of the regional hospitals that are kind of serving as major treatment centers, more the tertiary care centers that have had significant numbers of patients, and it did receive some of that medication to start potentially utilizing. So that one we'll see. Of course, we all know that the hydroxychloroquine research did not end up panning out for us,
right,
which is unfortunate. And then there are several other kind of emerging medications out there that are going to be exciting to see how they evolve. But like so many things, especially in medicine, you kind of have to roll it out and then give time to understand, what are the downsides, and you have to treat enough people that if there's a side effect that's significant but relatively rare, that it becomes apparent. And that was kind of what happened with the hydroxychloroquine. I mean, we'd known that there were significant side effects of that medication, but it wasn't apparent how significant that can be until it started being administered to literally thousands of people, and then it became obvious that was not going to be a great choice to use for this particular situation, especially at those doses. So yes, there's great things on the forefront and on the horizon, and the state has done a good job at securing supplies of investigational medications, and those are starting to roll out, but it's going to take time before we see data. There are a couple vaccines that, have moved into phase 1, and I think one may even be in a phase 2 type trial. Those two, though, unfortunately, do take a significant amount of time to demonstrate their efficacy. And the antibody testing that we've talked about so many times, the difference between the testing that they're going to be offering through the drive-through testing, where they're swabbing your nose to see if you actually have the virus, is just telling you, hey, right now, do I have the virus or do I not have the virus? The antibody testing is different. That's the blood test that's looking to see if you've been exposed and now are potentially immune to that infection moving forward. Unfortunately, we've talked before that there's more than one strain of coronavirus. There's several. This is just the new strain, and so they're still trying to work their way through which of the antibodies that show up in the bloodstream are truly going to be the ones that we need to be tracking that say, hey, you did have COVID-19, and you now should be immune to that disease. So those things take just lots and lots of time to take lots of samples and then sort through and identify which of those antibodies are really the ones that are telling us that you do have some immunity. So the vaccines are going to be hopefully part of our solution, but they're going to be a year or more out, unfortunately, before they'll really be something definitive. And then there's always, just like the flu vaccine, the minor antibodies, the minor shift in the the virus itself can be very relevant. So if you have a significant shift in the structure of the virus, even a well-designed vaccine then may not be as efficacious as we would hope. So. Bottom line, I guess, is this thing is going to be here to stay, at least for the foreseeable future. So we got to figure out how to get back and do it safely and continue to practice social distancing and those things and the hand washing and all of those things that we always do for viruses to keep ourselves safe. And then see what happens, because there's probably more immunity out there than we actually know, and we just aren't able to test.
Exactly. Oh, that's good information, Ryan. I mean, it is common sense that, even once they have developed a vaccine, pardon me, it's going to take a while before they know just how effective that is. And as you said, side effects and how severe are the side effects, how common are the side effects. So, I mean, that is a common sense matter, but it's good to know to put that information out there. Hey, folks, be patient, because this will take a while.
That is so true, and it's just it's one of the frustrations we deal with all the time. With you pick what disease, as far as whether it's cancer research or it's heart research or it's you name it. Unfortunately, it just takes time, and this is not going to be an exception to that. But some really smart people, a lot smarter than me, are working very hard on it, and I know that we're very fortunate to live in a country where the capability and capacity is there to identify a vaccine.
Absolutely. Ryan, thank you so much. We just appreciate you checking in with us like this and bringing us up to date on the latest news as to what's going on with COVID-19. It's, it helps to ease the anxiety of not knowing.
Absolutely. No, I'm happy to do it, and hopefully every week now I'm going to be on telling you about great stability and what we're seeing and continued improvement and a reopening of businesses, and that the plan that we've got out there is going to be successful.
Absolutely. Many prayers for that.
Indeed. Well, thank you, Gail, and thank you to WCRC.
You are very welcome. Thank you so much, Ryan.
Bye-bye.
Bye-bye. So much, Ryan.
Bye-bye.
Bye-bye. So much.